So it is such a pleasure to be here with you today to discuss thriving through menopause and for decades to come with lifestyle as medicine. So here's a picture I drew back when I was in kindergarten. So you can tell that I knew that I wanted to be a doctor from the time I was very young. And you can see that I thought I would be a very happy doctor. I have a big smile on my face. My patient looks very happy there. And I grew up eating healthy foods that my mom cooked with ingredients from my dad's garden. I exercised. I got enough sleep. I wasn't super stressed. So when I went to medical school and then did my residency training in obstetrics and gynecology, it was hard to keep living that healthy life. In addition to not really receiving education or very much education about nutrition and physical activity and stress management, I also had meals that were from drug representatives, or I would sometimes eat from the McDonald's in our hospital basement, which was sometimes the only thing that was open in the middle of the night. I would join patients there pushing their IV poles, and I would try to make the healthier choices. But when you're at McDonald's, it's a challenge. I didn't get a lot of sleep. I would work many 24-hour shifts. I usually worked 100-hour work weeks, and I didn't exercise a lot. So my lifestyle behaviors really suffered. And with that, I feel like I really went from thriving prior to medical school to just surviving when I was in my medical school and residency training. So I got out of training. I finished my training and I moved back to Colorado where I grew up. And I was like, I need to get my own health back in order. And I wanted to help my family be as healthy as possible too. And so I started really digging into the research around nutrition and physical activity and stress management. And the more that I learned, the more I found that these healthy lifestyle behaviors could really impact my health, but also impact the health of my patients. For example, as an OB-GYN, I was seeing obviously pregnant patients and patients who are struggling with PMS and fibromyalgia and all different health conditions. And although I was very good at using prescription medications and surgery and procedures to treat those, I really hadn't learned a lot about the power of healthy lifestyle behaviors to impact those health conditions. So as I learned more, I felt like I had this secret superpower in lifestyle as medicine, or these healthy lifestyle behaviors. I shared them with patients. Patients would come back and say, oh my goodness, in addition to helping with X, Y, or Z, I also have less constipation. I have more energy. I feel better. So it really was like this secret superpower. Now, why is this so important? Why is it so important that I learned about lifestyle as medicine? And when I refer to lifestyle medicine throughout this presentation, I'm just referring to the use of any evidence-based healthy lifestyle behavior, including nutrition, physical activity, stress management, sleep, social connection, avoiding risky substances to prevent, treat, and sometimes reverse chronic disease. Now, why is this such a big deal? So I pulled this information from the World Health Organization, and it looks at female life expectancy or healthy life expectancy. And so when you do this in the United States, women have fall 42nd in terms of countries as far as health, as far as life expectancy. However, when you pull up healthy life expectancy, so how many healthy years can we expect to live? I couldn't even find the United States on the first page of data. So although we're 42nd in terms of life expectancy, we're actually 83rd globally in terms of healthy life expectancy. So people in Lebanon, you can see we're right a little bit worse than Lebanon, Venezuela, Jordan, Nicaragua, Mexico, Jamaica. So there are people in 82 other countries globally who live on average more healthy years of life as females, even though we spend more than any other country on healthcare. So there is a major problem. So my goal with lifestyle medicine, our goal with lifestyle medicine is not just to lengthen the lifespan, right? We want a longer health span, more of those healthy years of life. And so it's not just that we want to move that functional limitation, disease, and disability later and keep it the same amount. We really want to compress morbidity or optimize that health span. And that's where lifestyle medicine comes in. Right now, I think too often we're just thinking that it's the status quo for many women to spend the last decade or 2 decades of their life with this functional limitation and disease and disability. And we really need to look at a different paradigm and say there's a different way. I spend time in the blue zones. This is not the blue zone, this is Colorado, but I spend time in the blue zones. And from the blue zones, those 5 areas on the planet where we see those populations who are living on average longer, healthier lives. We learn a lot from them and learn that there's a different way to age. So I moved back to Colorado. I embraced lifestyle medicine again. I became healthier again. My family healthier. These are my 3 kiddos. We had a new puppy. Everything was as great as it could possibly be. I am a professor at our university where I started the first Bachelor of Science in Lifestyle Medicine in the United States. Everything was good. I also was on the board of the American College of Lifestyle Medicine, the large professional organization, over 11,000 healthcare professionals dedicated to preventing, treating, and reversing chronic disease with lifestyle medicine. Things were going well, healthy, exercising, and menopause seemed like it was in my distant future. I was not thinking about menopause. I was treating patients who had menopause, but it was not on my radar until a routine screening mammogram at age 42 found a 2 centimeter mass that was invading my chest wall. I had no symptoms. I was not at high risk for this. I'd breastfed all 3 of my kids. I was doing all of the right things, but I still had this mammogram that found this 2 centimeter mass. And as I waited in the room for the interventional radiologist to come in and do a biopsy, I knew that it looked bad. I had seen the mammogram. And so I sat there, and as people stopped by, people who I knew, who I worked in the hospital with, they'd say, "Oh, why are you here?" Or, "Hi, Michelle. Hi, Dr. Tollefson." And I would say, "Oh, I had a mammogram that looked bad. I'm pretty sure it's cancer." And they would say, "I am so sorry. I'm so sorry." And I felt myself shrink smaller and smaller and smaller every time they said, "I'm so sorry." I felt like my power was decreasing. And so as I sat there, I thought, why me? Why me? What did I do wrong? I had been trained to find masses. I couldn't feel this mass at all. It was too deep behind my nipple and heading into the chest wall. Couldn't feel it, no symptoms. And so then I thought, why not me? 1 in 8 women in the United States will be diagnosed with breast cancer. And so as I sat there, I started to think of what I needed to do in order to help myself with this journey, with this fight that was ahead. And I knew I needed to rely on the lifestyle medicine pillars, this evidence-based information and evidence-based principles. So nutrition, movement, sleep prioritization, stress management, and social connection. These were things that I was already using, that I knew that science behind, but I knew I was going to have to rely on them now more than ever before. So I decided at that moment, while I was waiting for that doctor to come in, I actually purchased these pair of pink tennis shoes, and I now have like 3 or 4 pairs of pink tennis shoes. So I thought, okay, well, if I'm going to do this, I'm going to do it in style. I'm going to buy some new pink tennis shoes and embrace the breast cancer survivor movement and be as healthy as I can through whatever lies ahead. So the menopause transition, you can see prior to menopause, so in a woman's 20s and her early 30s, the estrogen is the orange and the progesterone the blue. They're fairly stable, going up and down with menstrual cycles. But in the menopause transition, we really see a roller coaster. You can see those levels going up and down and up and down. And so a lot of women think, oh, well, I'm not menopausal. I'm still menstruating. So maybe I shouldn't be having menopause symptoms. But really, women often have a lot of symptoms during that transition time. So while they're still having menstrual cycles, although they might be becoming more irregular, those levels are really going up and down. That's the menopause transition. For me, it wasn't so much of a menopause transition as a menopause crash. I was not premenopausal. I was going through normal reproductive age life. And then I went through chemotherapy and went through premature menopause. And then I also had my ovaries removed because of the type of cancer that I had, with an increased risk for ovarian cancer. So I went through a menopause crash. I went through a bilateral mastectomy, had my ovaries out. I went through 16 rounds of really aggressive chemotherapy. So I embraced what conventional medicine said would give me the best chance of surviving this breast cancer. And I also used lifestyle as medicine. I did movement every single day. I worked with a physical therapist. I talked to the dietitians about what could I do to optimize my diet. I worked on my stress and on my sleep. I felt really blessed to have this whole team of healthy lifestyle experts who helped me through that through that process. So I went through a menopause crash, and you can see, so menopause is officially defined as 1 year without any menstruation. So the average age in the United States is about age 51, though of course it can vary. So that purple line represents the average age of menopause. And then after that, levels usually stay fairly low as far as estrogen and progesterone. The physical changes that we typically see, though they can vary, are sometimes periods get a little more irregular. Many women, though not all, have hot flashes and night sweats. We often see skin and hair changes, often more dryness, maybe some brittle or more brittle nails, vaginal dryness, more aches and pains. Once again, not all of these. Menopause is so different. That menopausal transition is so different for each woman. We do see as estrogen decreases, we often will see some changes in cholesterol, maybe a decrease in bone density. And so some of these things can be treated with hormone replacement therapy. Now, I, being a breast cancer survivor with an estrogen receptor positive breast cancer history, would not consider taking hormone replacement therapy, though it does. I believe that it can be useful for some women. They need to weigh the risks and benefits and the age and look at all of those different things in their personal history, their family history. The hormone replacement therapy can help with hot flashes and night sweats, and also vaginal estrogen can help with vaginal dryness, or some hormonal treatments for some women. But the thing that I hear from most women that bothers them the most about physical changes during the menopausal transition is a change in body composition. So starting about, so on the y-axis, we have fat mass, and on the right, or on the x-axis, we have years prior to and after the final menstrual period. So I highlighted that purple in purple, the final menstrual period, but you can see about 8 to 10 years prior to the final menstrual period. So in a woman's 40s, typically, we start to see a significant increase in fat mass. And what worries me most, so I'm not super concerned about weight or even body mass index. There's a lot of different variables, but what really worries me is the decline that we typically see starting about a decade prior to menopause, with a decrease in lean muscle mass. And why this is so bothersome is because I want my patients to be able to live long, happy lives where they're physically active, where they're, it's not that you can't be, it's not that you can't thrive if you lose your independence, if you're in a long-term assisted facility, but I think that it becomes more challenging. And so I want my patients to maintain or increase their lean muscle mass. Now, we know as men age, they typically gain additional fat mass as well. That's what we typically see. But for women, as we age, we typically gain even more fat mass. You can see also it tends to be more abdominal, more of that abdominal or visceral fat, which has a higher risk as far as an increased risk of morbidity and premature mortality. So with the menopause transition, in addition to aging, with the menopause transition, we really see an acceleration of a typical deposition of more of this visceral fat. Now, even though it is common, it is not inevitable, which is why I want to be able to share with you some ways that you can really address that, whether you're premenopausal, in the menopause transition, or postmenopausal. So do not worry. Even though these things are often associated with menopause, what we do as far as nutrition and movement, all of those things are powerful. So don't despair. Don't step away yet. Emotional changes. We typically see a lot of these with the menopause transition as well. Because of those hormonal roller coasters that we see with estrogen and progesterone, we often will see mood swings, more irritability. We typically see women have more of those, more of a tendency to experience anxiety or sadness, emotional fatigue, brain fog. You can imagine if you're not sleeping well, and sometimes decreased confidence can go along with it too. So once again, these aren't all associated with it, but these are common things that we see. And so after I finished treatment, treatment is done. That's my Blake, my youngest son. I was just surviving. I had made it through treatment, and I was like, what are menopause symptoms? What is post chemotherapy? Like, I don't even know. But I knew I didn't want to stay this way. I was weak. I couldn't walk up the stairs every night in order to kiss my kids goodnight, even though I had exercised every day during chemotherapy, but I was weak. I was just surviving, and I knew I was going to use lifestyle medicine in order to thrive again. So our lifestyle behaviors are so powerful, and they impact physical and emotional health. And so if we're eating a lot of inflammatory foods, a lot of ultra processed foods, if we're too sedentary, if we're not exercising enough, if we're not getting enough sleep, it can lead us down a negative or a downward spiral of increased inflammation, where we have that low-grade chronic inflammation. Now, some inflammation is good. Like if we get a bug bite, we want a little bit of inflammation there. We see it get pink, and our body is able to help us fight that, but we don't want that chronic low level of inflammation. And that's what those negative or those detrimental lifestyle behaviors do is they increase inflammation. They make it harder for us to thrive. So I share all of this with you. So first of all, that you can have some self-compassion. Going through the menopause transition is hard. As I knew that it was difficult for many women, but as I learned more and more about it, I became even more acutely aware, and then going through it myself, that transition is hard. It's hard when your body has more of a propensity to distribute fat mass around your abdomen. Like that's hard. So first of all, I think it's important for us to be compassionate with ourselves and to realize our body does change during that menopause transition. Menopause is not a disease. It's not something that has to be treated, but just to realize that with that transition of hormones, there are some things that shift. And know that you are not alone. You are going through this, but so is every woman who has gone through that menopause transition. If we live long enough as women, we go through that menopause transition. So you are not alone. We are not alone. Even though we don't talk about a lot of these symptoms, many women are experiencing, or most women are experiencing these as they go through that menopause transition, or at least some of them. But I believe education leads to empowerment. And I'm here today to educate you with things that you can do with lifestyle medicine principles that can really make a difference. So I've shared the bad news with you, right? But now education, what can you do to empower yourselves, to empower other women who are going through this menopause transition, or who that have it in the future? Or even if you're decades beyond the menopause transition, say you're postmenopausal like me, I'm now 5 years postmenopausal. Whether you're in your 60s, 70s, or 80s, these things can also help you thrive for years to come. I want to encourage you to listen to your body. Now, menopause is so different, right? There's some women who go through the menopause transition and never have a hot flash or a night sweat. So listen to your body. I encourage everyone to have a notebook where they write down, like, what are the symptoms that you're experiencing? And then investigate what helps you as far as healthy lifestyle behavior. So if I try to increase my fiber, if I try to get a little more sleep, how does that impact the symptoms that I'm having? And as women, we're so often caregivers for others. Remember, you need to care for yourself. You need to engage in these healthy lifestyle behaviors before you can help others. So remember, put on your oxygen mask, as they often say on the airplane, before you put it on someone else, so that you could help a child. So the menopause transition, I like to think of it like a caterpillar going through that metamorphosis. So with a caterpillar, before the menopause transition, maybe we're caterpillars, we're going through life. And then during that transition, something happens and we can't go back to how we used to be. Like, there's a change that's happening, but it's an opportunity. That change, that time in the chrysalis, when we're changing from what we used to be to what we're becoming, is an opportunity to really embrace these healthy lifestyle behaviors, because our lifestyle behaviors can impact how we go through the menopause transition to menopause and then postmenopause. We have an opportunity to impact our health trajectory so that we're not surviving, but moving toward thriving through that menopause transition and for decades to come. So these healthy lifestyle behaviors that we'll focus on today lead to that upward spiral of physical and emotional health and well-being. Also, the exciting thing is it's not only going to decrease your risk of cardiovascular disease, decrease your risk of type 2 diabetes, help with a healthier weight, and decrease your risk of dementia. All those things are really good. Those are really good and really important. And I think you probably already know those. But when we embrace these healthy lifestyle behaviors that I'll share today, they also impact energy. Most women, as they go through the menopause transition, struggle with a decrease in energy. As estrogen decreases, so do our number of mitochondria, the powerhouse of the cells, and they're not as functional. And so physical activity can help with that. So these changes help with energy. They help with our functional ability, right? I want to be able to travel when I'm in my 80s and 90s, and I want to be able to lift that suitcase, and I want to be able to get it off the thing when it comes down and goes around the belt. I want to be able to do that with ease. I want to have a good mood. I want to have brain health, and I want to have a purpose-filled life. So all of these can be impacted by those healthy lifestyle behaviors. So that transition is a window of opportunity, really wherever you're at. Anytime you have a diagnosis, anytime you're going through a rough time, it's really a window of opportunity. And so the lifestyle medicine tips that can help you through that transition that I want to focus on today are focusing on fiber, savoring blood sugar stability, not those sugar spikes, getting in more movement minutes, striving for strength, which is so important for women during the menopause transition and beyond, prepare for pillow time, enhance your energy recovery environments. As women often struggle with fatigue, we need to be really mindful of what we're doing to increase our energy recovery, take some breath breaks, and then also to prioritize people and purpose. So that's what we're going to cover today. So now the good news. Let's start with nutrition. Number one tip, focus on fiber. Recommended daily intake for Americans, according to the general guidelines, it's about 25 grams of fiber per day, maybe a little lower after menopause. However, that should be like the lowest that we strive for. Now, fiber is found in plants. You probably know that already. And so we are a fiber deficient nation. About 95% of American women do not get adequate fiber. We don't even meet that low benchmark of like 20 to 25 grams a day. Women are typically getting about 12 grams a day of fiber. And that's because we're eating so much ultra processed food as a nation. Now, fiber is so important for digestive health. We have an epidemic of constipation in the United States. And we could do so much just by eating more fiber. Fiber also helps us with attaining and maintaining a healthy weight. It helps with mental health, having an adequate energy, and decreases the risk of so many different health conditions. So my 19-year-old daughter taught me how to use AI generated images, and I put in all the words I could think about the menopause transition gut microbiome. So as estrogen decreases in our gut, so taking a step back, gut microbiome, probably already know there's trillions of bacteria, trillions of different organisms in all over, like our skin, vaginal microbiome, gut microbiome. But we're focusing on the gut microbiome, so in our intestines. We're going to focus on the bacteria, the trillions of bacteria in our intestines, and they have a tremendous impact on our health. Now, as estrogen declines through that menopause transition, there's a tendency for more pro-inflammatory bacteria to overproduce or reproduce. And so that menopause transition is really a time when the microbiome is vulnerable. And so it's not that eating healthy before menopause or the menopause transition wasn't important. Like it's always important, right? For my kids, it's always important across the whole lifespan. However, during the menopause transition, there's increased vulnerability. And so it's extra important to eat a lot of fiber, to eat healthy foods, to really decrease or eliminate those nutrient poor and calorie dense foods that make up too much of our American diet. So the gut microbiome, you guys are probably already experts listening to this, but I love to explain this with some graphics from some literature to hopefully help you understand it better, or even if you already understand it really well, to maybe be able to explain it better to others. Because I think a lot of time people are like, why are you so into eating plants, right? Why are you whole food plant-based? Why does my 8-year-old son have to explain this at school? I got a text a few days ago about, your son says that he doesn't eat animal products, like what's going on? So to be able to explain this not just for ourselves, but to others. So this is a cross section. So if you imagine the lumen of the intestine, so everything's moving through, right, from our mouth down to our stomach, going through the intestines and out to the end. And so this is a cross section of that wall, like you're looking through it. And so the green and red I put there, so we're going to say the green represent good bacteria, and the red represent inflammatory bacteria. And so we all have a mixture of these. We want more good bacteria than bad bacteria. And so with the gut microbiome, let's pretend we're eating a low fiber diet. Now, before, I would say, like, if I had to pick one food that it has no nutrients that I don't, that I would really eat, but let's just say a purple Skittle. So let's just take something that probably has no nutritional value, right? It's coming down the GI tract. And if you eat a lot of these inflammatory foods, so foods that are ultra processed, high in fats and added sugars, and not your healthy fats, but you're eating like these ultra processed foods and you don't have a lot of plants, what happens is that those bad bacteria, those inflammatory bacteria start to multiply more and more. Along with that, we're starving those good bacteria. We have a decrease in short chain fatty acids. And so we see a decrease in overall energy for our body, an increase in inflammation, which we do not want. We see a worsening of mood, increased risk of several different types of cancer. And so this is, again, an AI generated image. When I put in all these different words about inflammation and gut microbiome, our bacteria, I didn't even put in like unhappy bacteria. I just put in like all these different words, inflammation. This is what the image came up with. A really sad intestine, right? Our intestines are sad. The microbiome is sad because we're starving our good bacteria of fiber. They're starving. We're not giving them enough plants. And once again, I'm a fan of having more than 25 grams of fiber And then also, as we're starving those bacteria, they start to eat away at our mucus layer. That yellow arrow is showing that mucus layer. So we want a nice thick mucus layer to keep everything moving through the intestines. But if they can't eat fiber, they're actually eating away that mucus layer and it gets really thin. And so what happens is that things that should be staying in the intestinal lumen, right? So we're imagining feces and all these different products going through the intestinal lumen. What should be staying in the intestinal lumen actually is able to sneak through some of those different endotoxins, so bacterial products and different things that are inflammatory. It's not just nutrients that are going through. Because we have leaky junctions, because we have that thin mucus layer, there are products that seep through that should be staying in the intestine, headed out to the toilet. They're able to seep through into our blood. That causes an increase in inflammation, an increase in our immune cells, because we have the intestine, we have those blood vessels wrapped around. So that the blood vessel you see on the bottom, that's actually the systemic circulation. Those are their blood vessels ready to take nutrients from our intestines. But now they're taking nutrients and they're taking some toxins and different product that should have been staying in the intestines headed to the toilet. They're actually taking those and causing systemic inflammation. It also causes disruption of hormonal levels. It throws everything out of whack. And so the intestines are unhappy. They're inflamed. They're not what we want. It also leads to hormonal chaos. That's the best picture I could find of chaos. Hormonal chaos when we have things leaking through into the systemic circulation, causing that extra inflammation. So what is the remedy for this? It's eating more real food and less or no junk food. It's eating those high quality foods. It's nourishing the gut microbiome with a whole food, plant forward way of eating. We want to be eating foods that are nutrient dense, that are minimally processed or unprocessed, that are anti-inflammatory and that are fiber rich. So we need to be eating a lot of plants. And when we do that, right, so the green, now I'm representing that that's, you're eating all your plants, you're eating your fiber, you're eating your fruits and vegetables and whole grains and nuts and beans and seeds, you're eating that. And what happens is that you get the good bacteria, all of those green bacteria, they diversify, you get more different types of good bacteria and they reproduce. You get all of these good bacteria. Also, your bacteria are busy eating away at that fiber. And so you can see as the plants come through, the fiber eat that. The nutrients are able to get through, but you don't have those leaky junctions. You have that nice thick mucus layer. Remember how it was so thin in the other one? You have a nice thick mucus layer. So that mucus layer is keeping what should be in the intestine going through, and you don't get those endotoxins or those inflammatory factors that are coming through. You just get the metabolites and the good things that are nourishing your body. So the bacteria are happy. Another AI images, I had fun with this when I started looking at these with my daughter who's in college. So the bacteria are happy. They are healthy, they're reproducing, you have a decrease in inflammation. We get the production of those short chain fatty acids as the bacteria are eating away at that fiber. You get an increase in the short chain fatty acids. They increase energy, they decrease inflammation, they improve mood, they support hormonal health, they decrease the risk of cancer. So on and on and on, all of these good things. That mucus layer is nice and thick, and what is in the intestine is actually moving all the way through and not seeping through. And your intestine, when it has your microbiome, when it is eating a whole food plant forward, plant predominant diet, it is happy. We also see an improvement in menopause symptoms. Women who eat more vegetables and fruits, women who have more of a plant forward diet, more of a Mediterranean whole food, Mediterranean minimally processed plant forward way of eating, they typically will have decreased menopause symptoms compared to women who are not eating that way. Also, I'm a huge fan of soy. Not only does it decrease inflammation and help make it more likely that you don't get that buildup of visceral fat. So soy, whole and minimally processed soy foods, and I recommend organic products. They've been shown to help with decreasing that visceral fat. But also, in addition, there's some research showing that they can, for many women, may help to reduce moderate to severe hot flashes and night sweats. So when I'm talking about minimally processed, so I'm talking about edamame, soy nuts, tofu, tempeh, miso, soy milk. I'm not a fan of soy isolates or supplements. I think they can do too much to impact those estrogen receptors. And I think we just don't know too much about it. This is safe even for breast cancer survivors like myself to be having 1 to 2 servings a day of whole or minimally processed soy foods. We know that when people eat a healthier or more plant-forward diet, women typically have better physical functioning. When women start to increase their intake of fruits, vegetables, whole grains, nuts, beans, seeds, they typically have less bodily pain. We saw an improvement in their general and mental health. So this was like over 100,000 women who were part of the Nurses' Health Studies 1 and 2. And they saw, did they change their intake? And when they increased their plant food, when they started eating more fiber, when they started eating more of these whole and minimally processed plants, they improved their general and mental health, and they had increased vitality. So they had a better chance at thriving through that menopause transition and beyond when they increase their intake of healthy plant foods. On the other hand, those women who increase their intake of unhealthy foods, regardless of whether or not they didn't contain animal products. So we're kind of looking at a separate discussion. Let's just say that they're like, okay, I am vegan, but as you, I'm sure know, you can be a very unhealthy vegan. So imagine that somebody's eating a lot of ultra processed foods. They're eating, maybe they're not eating animal products, but they're eating a lot of ultra processed foods and junk foods. We saw women who increased that typically had a worsening of their physical functioning, more bodily pain because it's creating that inflammation, right? Worse general and mental health and more mental role limitations. Now, the exciting thing is that increasing fiber intake, it's not just good for your gut microbiome, it also decreases the risk of several different types of cancers and cancer recurrence if you're a cancer survivor like me, according to the American Institute for Cancer Research. It also improves bone health in women. It's been shown to support brain health. When I went through all this different testing, going through menopause prematurely, and not being able to use hormone therapy with that premature menopause increases my risk for dementia. Also, I have a copy of the ApoE4 gene, which increases my risk of dementia. And so I do everything I can to optimize my brain health. And the same way of eating is supportive of brain health as well. It's also supportive of our number one killer, which is cardiovascular disease in women. So this whole food plant predominant way of eating that's fiber forward is beneficial for so many different areas. So we want to prioritize our plants. Fiber is fabulous for females. Vegetables, fruits, whole grains, nuts, beans, seeds, limit or avoid ultra processed foods. Help make those healthy substitutions. And so instead of those Fruit Loops, and I don't even know what that purple drink is, but eating like maybe some steel cut oats with it looks like they have some chia seeds and some almonds and blueberries, eating nourishing snacks. I recommend that my patients keep a fiber diary to see where they're at. And I encourage that something, even if you're a healthy eater, just see like, where am I at with my fiber intake? Now, remember, the recommendation is to be getting about 25 grams or so a day, 20 to 25. But many experts believe that more is probably better. However, I don't like for women to do a huge jump all at once. So if you find out that you're at 10 and you want to go to 20, 25, like don't do that all in one day. Or if you're at 20, 25, and you're like, I want to try 30, which is the recommendation for the American Institute for Cancer Research for decreasing risk of cancer. I recommend that people go up slowly so that your intestine can get used to it. But fiber is fabulous. Find out where you're at and then start where you're at and work your way up. Look for ways to incorporate more fiber into your diet. For most people, certain people have certain medical conditions. See your doctor or where you're at, but focus on getting fiber. Tip number 2, savor stability, savor blood sugar stability, not sugar spikes. So we want to do all we can to minimize those blood sugar spikes. Those are associated with more inflammation. They're associated with more menopausal symptoms. And as I mentioned before, when the estrogen levels decrease, we see a shift in that microbiome toward more inflammatory species. So that's typical. It's not inevitable though. So there's a lot that we can do, but we need to really be thinking about how do we help our gut microbiome. Now, as estrogen decreases, what happens is that we feel hungrier for sweets. And so I think it's important just to understand that hormone levels are changing, that we're going to feel these different things, or that you might feel these different things, and to know, like, I'm not crazy, this is going on. There's changes as far as hormones, but just because I may feel hungrier for sweets does not mean that I have to go after these ultra processed foods, right? There's ways to have, as you probably know, eating fruits, feels so, or it tastes so sweet, especially as you've gone longer without that ultra processed foods. We want to avoid the sugar cycle. So what happens with the sugar cycle is that we eat some ultra processed food. Maybe we eat some white bread, white rice, candy, soda, any of those different things. Blood sugar is going to spike. Those are simple carbohydrates. With that sugar cycle, then insulin also increases. And what we have then is a sugar crash. We don't just come back to where we were at. Often with that insulin rising really high, we get a sugar crash. Now, if we eat complex carbohydrates, so these are our plants, these are whole and minimally processed plants. So we're eating our vegetables, our nuts, our beans, our seeds, our whole grains. We have complex carbohydrates that do lead to an increase in blood sugar, but it's not so dramatic. Our insulin hopefully is able to compensate for that, but not overshoot so that our blood sugar level comes back down. With protein as well, we want to be getting in healthy sources of protein. And so with protein, our blood sugar level goes up and then comes back down, but it doesn't go up as much as it does with a carbohydrate. And then with fats, obviously there are good fats and bad fats. There are unhealthy types of protein, eating processed meat, unhealthy type of protein source, eating beans, a healthy source of protein. Same with fat. There's healthy and unhealthy sources of fat. But you can see that it increases blood sugar, but it takes longer for it to come back down to baseline. It's more stable, not as much of an increase. So when you're eating complex carbohydrates, you're eating healthy sources of protein, you're eating healthy fats like avocado. What happens is that your blood sugar doesn't spike as much as it does with those simple sugars. You get less of that sugar cycle. With that sugar cycle, when our blood sugar falls, then we're hungry again and we're really craving sweets, and we might feel more mood changes, more emotional lability. And so we want to be able to eat these things that help our blood sugar to stay fairly stable, that really help us to have a healthy microbiome. They also help us with increasing our energy and sustaining it rather than that energy up and then energy crash. Also, we know that eating those high quality foods and trying to have a more stable blood sugar helps with decreasing visceral fat and increasing lean muscle. So we know that women too who ate a healthier diet, it helps to attenuate some of those metabolic changes that are typical, though not inevitable, during the menopause transition. So they help to attenuate those changes. So a high quality diet, a whole food or minimally processed plant forward diet helps to decrease visceral fat, decreases inflammation, and helps to stabilize blood sugar. Lots of research around the Mediterranean diet, but even what they eat in the Mediterranean now is said to be too many ultra processed foods, too many foods that aren't healthy. So even if we're doing research around the Mediterranean diet, it's more of a whole and minimally processed, more of a plant forward diet. But a plant forward Mediterranean-ish style diet with lots of whole and minimally processed foods seems to be what the research shows is best for that menopause transition and really stabilizing those blood sugars. Also, dietary soy. When we're eating that whole and minimally processed soy, it helps to increase the anti-inflammatory microbiome species, decreases inflammation. It also decreases glucose. So plant protein dietary soy is good for helping us to maintain our blood sugar levels so that they're more stable and decreasing visceral fat. Now, here's a picture of, I had my smoothie this morning. Leafy greens are important as well. We talked about blood sugar stability in and so eating green leafy vegetables. Here I had some chopped kale this morning, also had some organic blueberries. I had some ground flaxseed. I had some soy milk in it to get some soy. Green leafy vegetables, they help to increase lean muscle mass and decrease frailty. So they're also important for women, especially as we look at trying to maintain or increase our lean muscle mass. Now, it is important for us to be getting adequate protein, and you probably have heard most Americans get more than enough protein, right? So it's not like we need to be obsessed with protein, but going through the menopause transition, we need to make sure that we're getting enough, and that's totally possible whether you are vegan, whether you're vegetarian, but it's definitely possible, but you just need to be mindful of getting in adequate protein. Protein is so important for satiety, for making us feel full. It's important for muscle growth and repair, for keeping our metabolic rate higher, which we know often declines with the menopause transition, often, but not inevitable. Eating adequate protein is important for bone strength and decreasing abdominal fat, and important for neurotransmitter production for our mood. And so I love Brenda Davidson's plant. I think it's called Plant Powered Protein or Plant Protein. She has a book on plant powered protein that's just fabulous. She really follows the literature. So, and based on that, we recommend protein-rich meals or snacks every 3 to 4 hours. And so it's not that you need to be, you don't need animal products in order to do this, but you need to be thoughtful of where you're getting your protein, getting high quality protein. Enjoy beans, seeds, nuts, tofu, tempeh, and soy milk. If you're somebody who eats animal products, maybe some Greek yogurt, maybe some salmon, or looking for healthier animal-based sources. And then there's synergy with resistance training. So these are just some examples of how you can get in some quality protein, some complex carbs, and some healthy fat. So maybe you do your smoothie and you get in some, maybe you put in some chia seeds, or like I put some ground flax seeds in there. You're getting some complex carbs, some healthy fats. You can do your steel cut oats, right? And I mix my steel cut oats often with soy milk. So I'm getting in some more of that protein, some soy. getting in a variety. You can put in some different nuts, get some healthy fats in there. There's all different ways to sneak in these different things. Here is an example of like a bowl that you can make. The avocado, I love avocado toast on a really, I have a bread that is made at Great Harvest called High Five Fiber that I just love. It is dense, it is hearty, and I put my avocado on there, and it's just great with some black beans that I make, some black beans that I try to make up every week, a black bean dip. So I put some of that on there. But here you have some quality protein. It looks like there's some tofu, there's some complex carbs, some healthy fats. Maybe some nut butter on apples. You're getting some quality protein, some healthy fat, some complex carbs. And so a variety of ways that we can get in those healthier proteins, those complex carbs, and healthier fats. So also fermented food, there's some research out there showing the benefits of fermented food. So there's research on probiotics where you buy a probiotic in a certain bacterial strain. And I think that's okay for some, if you're working with somebody who really has expertise in that area, but I like for my patients to get their probiotics from fermented food. So I try to get some fermented food in every day. So that's like tempeh, that's your kimchi, that's your miso. There's a variety of different fermented foods. Watch out, some of them have a lot of added salt, so you need to be mindful of that so you're not going way over on salt. But fermented food really helps your gut microbiome too. Now, I'm going to meet people where they're at. I'm guessing if you're watching this, you're already probably super healthy. You're bought into all of these different things, but I like to meet people wherever they're at with no shame, blame, or guilt. That comes from Dr. Beth Brady's. I work closely with her with the Paving the Path to Wellness program, but no shame, blame, or guilt. Meet people where they're at and help them to move along the spectrum. We want food to be joyful. We want to be able to celebrate when we eat healthy food. We want it to be nourishing. We want it to be delicious. So those are the 2 nutrition tips. Let's move on to physical activity. So I want to make sure you're getting in your movement minutes in order to thrive through the menopause transition and beyond. Now, you probably already know your brain or your body loves physical activity, right? You know, it decreases your risk of cardiovascular disease and several types of cancers and type 2 diabetes and all of those different things, right? Movement, physical activity is good. But I want to focus on the importance of physical activity for brain health. Physical activity, getting adequate movement helps to increase our motivation. It helps us with focus. It helps us to learn new things. Physical activity is very important also for our mood. So when we go through the menopause transition, we're more likely to have that mood instability. Doesn't mean that we necessarily will have that, but it's easier to be thrown off balance. And when we are getting physical activity, we're releasing endorphins. It elevates serotonin. So it leads to a boost in mood. In fact, Dr. Eddie Phillips, who I worked with years ago, I think over a decade ago, he told me not exercising is a depressant. He's with the Harvard Institute of Lifestyle Medicine, where I used to be guest faculty. So not exercising, not getting adequate activity is a depressant. We need to be physically active. Also, when we move, we get a release of brain-derived neurotrophic factor, or BDNF. Now, I love that John Rady calls this miracle grow for the brain, or he's referred to it at one of the presentations I went to of his, because it helps to grow new brain cells. So years ago, we used to think that once you had all the brain cells in adulthood that you had, then it was just a decrease from there, and you tried to just hopefully not lose too many. But now with physical activity, we actually have neurogenesis, the genesis of new brain cells. We have neuroplasticity, change in those connections. We have a development of new connections. So getting physical activity is so, so important for brain health, for mental health, for increasing our cognitive reserve, for decreasing our risk of getting dementia. We also know that physical activity helps energy. So as women go through that menopause transition, as I mentioned before, we typically have a decrease in the number of mitochondria, as well as a decrease in function of mitochondria. And the mitochondria are like the powerhouse of the cells, like the batteries of the cells, if you remember back to like biology in high school. And we want to increase those, right? We want to do everything we can to help our mitochondria. And how do we do that? Because so often we're like, oh, well, there's decreased energy, but it's often happens, but it's not inevitable. Oh my goodness, there is such hope. There is such excitement. There is such possibility with lifestyle medicine. So when you're more physically active, you help to develop you help to make more mitochondria, and you help your mitochondria that you have function better. So physical activity is important across the whole lifespan, but when the menopausal transition and beyond, physical activity becomes more important now than ever. We also know that people who exercise regularly, not just like once every week or two, but people who exercise regularly, that it helps, that they typically have less menopause symptoms. Now, this is me behind our house. And so I think a lot of people think I'm either somebody who loves exercise or I'm not. Now, I am not a marathon runner. I work with Dr. Amy Commander, is director of lifestyle medicine for oncology out at one of the Harvard Health System hospitals. And Dr. Beth Brady's, once again, she's at the Harvard Health System Hospitals. They're the two co-authors of the Paving the Path to Wellness books that I've done with that nonprofit. Now they run. Dr. Commander just finished the Boston Marathon a few days ago. She's amazing. They are, they do more of that. I'm not a marathon runner. I'm not somebody who just like naturally wants to go play competitive sports. And you can eat, but you can get in adequate physical activity. If you're somebody who's like, I don't normally gravitate to that, you can get in 150 minutes is the recommendation, that we have at least 150 minutes of at least moderate intensity exercise a week. And you can get that in through walking. So here I am behind my house. Obviously, it's a snowy day in Colorado. That's my dog Cosmo, who's no longer a puppy. He's about 5 years old. And so we will walk, and we walk fast. Now, on nicer days, I'll do some Nordic walking, which is great with these like, they kind of look like ski poles, but you can really get some upper body movement. You can increase your heart rate, but there are it's important to find what you like, what's good for you with physical activity, but to be finding something that you love and doing, hopefully at least 150 minutes a week or more. Now, every minute counts. We used to think that exercise had to be done in bouts of like 20 minutes or 10 minutes, but now what we found is really every minute counts. So you can space it out throughout the day, find ways to increase movement throughout your life. In fact, we know that people in the blue zones typically move naturally. They're not going to the gym, but they find a lot of ways to move throughout the day. They're often gardening, walking up and down hills, sitting on the floor and getting up. But every minute of movement counts. Now, what obstacles are you facing? This is a picture of me, or a picture of my wrist. And I was getting that reminder to get up and stand up and move a little for 1 minute while I was creating slides. Now, I love teaching. I love presenting. I love creating slides and figuring out ways that I can share the passion, the power of lifestyle medicine with others. But sometimes I get so excited that I sit too long in this chair. And so my obstacle that I'm facing is that I get really excited about wanting to present and share information. And sometimes I want to just get like focused on creating cool slides and looking at the research, that I won't get up to move as much. And so thinking of what your obstacles are, and then thinking, how can I address these obstacles? So actually my feet are on it right now. I have this ball chair. It's a picture of the one. Anyway, I don't have any association with the company. Anyway, but this is my ball chair. And I sit on this throughout a lot of the day, but it helps me to bounce more. I'm actually not sitting on it right now because I've been told sometimes I just start bouncing without thinking about it. And then like after 2 hours of presenting, you're like, would she just be still? But it can help me get in some more movement into my day. Also, I'm a huge fan of the literature on exercise snacks. Now, we do recommend talking with your doctor, with your primary care provider, and get clearance for physical activity before beginning a new program or increasing your level of activity. We want you to all to be safe. But there's some research around exercise snacks and more vigorous activity being done periodically throughout the day if you've been cleared to do this. It can help offset prolonged sitting. And so I actually have a bracelet that I'm not wearing today, but I have a bracelet that helps me track behaviors. And so what I do is I will try to run up and down my stairs or dance to some music. And I try to take a break at least every hour. Every half hour is ideal. But even if it's just for like 2 or 3 minutes to get up and to do some movement, even if it's just a minute, there's some research on exercise snacks that are only a minute, but it helps to offset the detriments of prolonged sitting. Because even if you do your cardio, I do it every morning, I try to get in my cardio, but even if you do your cardiovascular movement, sitting throughout the whole day and not getting in movement minutes is really bad for your physical and mental health too. In fact, some people are saying sitting is the new smoking. So what can you do? You can stretch. I'd encourage you to stretch now. I don't usually do presentations that are this long, but oh my goodness, I hope if you're sitting or if you're listening to me, that you're not sitting for a whole 2 hours, but I encourage you just to stretch now. It feels so good, even just for me while I'm sitting here talking, to move my hands, do some different wrist circles, stretch. I'd encourage you to stand up maybe and stretch side to side, but to get some movement in. If you can step away from your computer, if you can still hear me, maybe you want to do some stretches or think think about incorporating this. Maybe you want to have a dance party. It's, you have 2 minutes between your meetings. Get up and put some fun music on. Maybe it's while you're watching TV. Maybe you can get some more movement in, right, during commercials. Or maybe it's that you do some stretches. Sit down on the floor and do some stretching while you're watching TV, while doing chores. I don't know. I've never been this happy while doing while mopping. But anyway, how can you get some more movement in your day? Can you park and walk further? What can you do in order to increase your movement? Maybe it's taking a call outside, right? Rather than sitting down on the couch and talking to somebody, can you just get up and walk around your house or get outside if it's a nice day? But how can you move more? Can you schedule it? Can you put it on your calendar? Can you make it a priority? I am so busy too. I have a son with some special needs. I have 2 younger boys. I work full time. I get it. I get it. Life is busy, but physical activity has to be a priority. It has to be a priority if you want to thrive through the menopause transition and beyond. You need to move. So schedule it, make it a priority. Research shows that if you have an accountability partner, you're more likely to stick to it. And then track your progress, whether that's a little bracelet or whether it's writing down like how many movement minutes did I, or how many movement exercise snacks did I take today, but track your progress. Now let's talk about striving for strength. This is tip 4, striving for strength. Now, when I really started to dig into the menopause literature, when I realized that I was going to go through premature menopause, I really started to look at, and when I felt so weak after I went through chemotherapy, I became weaker. Even though I did some physical activity and I did what I could during chemo. I mean, I had really intense chemo, and my physical activity that I was doing was kind of all I could do with physical therapy supervision. And so I lost some lean muscle mass. And when I looked at the literature about how hard it can be to gain lean muscle mass as a postmenopausal woman, the literature is hard to look at. And so what happened is it made me even more adamant about doing everything I could to maintain the lean muscle mass that I have. And like, I'm not trying to be a bodybuilder, right? Like, that's not my goal. My goal is to have muscular strength so that I can lift things that I want to lift, so that I can play, so that I don't get fatigued. And so I think we need to strive for strength. With menopause, what we often see is an increase in body fat. So as estrogen goes down, we typically see an increased likelihood to have more body fat, increased muscle atrophy, decreased muscle strength, decreased bone strength, and decreased aerobic capacity. So that's often if women keep doing the same thing. They're not doing any resistance training. They just keep eating usually the same things. They, they're maybe just moving a little bit, or maybe they're doing some aerobic activity, but not resistance training. That's kind of like typically what happens. However, remember, it is not inevitable. Physical activity, getting adequate physical activity helps to counteract this, helps to ameliorate these changes. So physical activity has been shown to decrease body fat, to increase muscle mass. It is never too late to increase muscle strength. It is never too late to increase bone strength, to increase aerobic capacity. Physical activity, also, if we look at age-matched women and men, we find that women are more likely to not be living independently, to have an increased risk of falls and fractures, and to be hospitalized. And so being physically active increases your chances of living independently. It improves physical function, which leads to quality of life, more energy, more strength, and a positive mood. Also, we know that as we go through the menopause transition, it becomes harder to synthesize more muscle, which is why we need to get adequate but not excessive dietary protein. The recommendation is 0.8 grams per kilogram per day. A lot of experts, I once again recommend Brenda Davis's plant-powered protein book. If you're trying to increase your lean muscle mass, if you're older, maybe it's closer to like a 1 gram per kilogram per day, maybe more for other populations. So it's not like crazy excessive, but we need to be getting adequate dietary protein. We need to be getting an aerobic activity and also some resistance training where our muscles are working against a force, and decreasing our inactivity. This is all important for increased muscle synthesis. So the optimal exercise for postmenopausal body composition, when we look at systematic review and meta-analysis, so we're looking at a lot of different studies, when we put all of that together, we find that a combination is best. Resistance has been shown to increase muscle strength and mass. Once again, not being a bodybuilder, but being able to maintain or maybe even gain a little lean mass so that we can do what we want to do. And aerobic activity has been found to be best at decreasing fat, especially that visceral fat, which is that inflammatory and that most dangerous fat. So resistance training myths. If you do some resistance training, you will not become a bodybuilder. Like you really need to train and focus on that if you really wanted to become a bodybuilder, right? But doing some resistance training is just important for our health and our well-being. Now, in the blue zones where they live the longest, healthiest lives, they're doing gardening, they're doing physical activity chores, but our modern society is so it's so easy to be sedentary for many of us for so much of our day, but we need to find ways to get it in. I actually have some of those resistance bands. I actually have them hanging up on my wall in my den right there so that I can't look forward aside from my computer and not see them. So my resistance bands are right there. I have I have a thing on the back of my door, like a strap where I have some resistance bands always hanging there so I can do some resistance training if I'm watching TV, I can be doing it. But there's different ways to get in resistance training. It's not just for bodybuilders. It's not just how your body looks. I think so often people think too, like, oh, people who do resistance training, they're just into how their body looks. Well, that's fine to care about how our body looks, but we're doing it for how we feel, for how we function, for maintaining our independence. There's a lot of different options. It's not just going to the gym. I try to get to the gym where I do some resistance training with a trainer. I do it once a week for 30 minutes because it just really helps me stay on track and to know I'm doing the right form. But you can also do it at home. You can use your body weight, like if you're on your knees or even on against a wall by doing some like body push-ups, using those elastic bands, using water resistance. You can do water aerobics and get some water resistance. I have some different things I can put on my hand that are kind of like they're kind of like a flipper or a fin, but you can get more resistance in the water if you're using that. You can use free weights, you can use weight machines. There's a variety of different ways to get in some good resistance training. If you look at just the information on resistance training, separate from aerobic activity, people who do resistance training typically have improved mood, energy, quality of life, as well as decreasing the risk of cardiovascular disease, type 2 diabetes, cancer, musculoskeletal problems, and premature death. So there is reason to get in resistance training. Now, if we look at menopause, perimenopause, and postmenopausal women, most women aren't getting in their aerobic activity, and it is rare that we see somebody who's getting an adequate resistance training. And so I'm going to acknowledge adherence is challenging. The research shows us that adherence is challenging, but you can do it. Now you have the education, you know why it's so important. Adherence is challenging. So here are some things according to the literature that make it more likely that you will be successful with your resistance training. Focus on the health benefits. So it's not just about how you look, right? It's about thinking about how is this going to impact my brain health? How is this going to impact my ability to do what I want to do when I'm 90 years old, right? I want to be playing with my grandkids. I want to be traveling. What are the health benefits? And then how, as Peter Attia says in his book Outlive, training for the centenarian decathlon, right? Like, what do I need to be doing now so that that typical age-related decline isn't going to happen? What can I do to ameliorate that so that I never lose my functional independence, hopefully? Work with a qualified trainer or physical therapist. For me, that's been huge. If you can get a referral to a PT, they can help you put together a program to really optimize your workout or optimize what you're going to do it safely. I've worked with physical therapists in the past. I also work with a trainer, as I mentioned, once a week. But there are a lot of good resources out there. Individualize it. Do what's best for you. For me, it's like a 20 minutes or so in the gym once a week. It's 30 minutes with a trainer once a week, and then it's some different resistance bands. A few minutes here and there. You don't need tons, but doing some resistance training. Do what you enjoy. Find what it is that you enjoy, and will do it. Anticipate your positive feelings. They found that those people who anticipated how they were going to feel after doing that resistance training, after doing that physical activity, were more likely to continue to do it. So when you're thinking about like, oh, getting up for the day, think about how am I going to feel? How is this going to positively impact my mood, my brain health after, with finishing or with doing this? So anticipate those positive feelings. Find a supportive environment. So for me, that's working with a trainer once a week, but find a supportive environment. Is it finding a friend? Is it someone, an accountability buddy? How can you try to get that support that you need in order to do that resistance training? And then here's me at the gym, and I was actually wearing like a dressier shirt. And I took this picture because the gym was going to close. It was the weekend. It probably closed at like 6:30 or something. The gym was going to close, and I knew I didn't have time to run home and get changed into what I wanted to come do this. And I was like, you know what? I don't really care. I don't care if I look out of place. I don't care if this isn't what I would typically wear to the gym and I don't have the right shoes. I am going to go and I'm going to do what resistance training I can safely because I belong at a gym. I think that's often we have these stereotypes or we have the stereotypes of like it's bodybuilders or it's men who belong in the gym. It is not. You belong anywhere where you want to be to increase your health. So plan for obstacles, plan for challenges, whether that's gyms closing or whether that's stereotypes. What is it that you need to bust and to change those myths? We are not aging like society might say a typical woman is meant to age, right? Like we are meant to age and thrive. We are meant to live with hope and to be physically active. You deserve to be here. You deserve to be your best self, and that includes movement. Now let's talk about sleep and preparing for pillow time. I'm going to take a quick drink. Once again, I encourage you to get up and move around. This is a long time with listening to someone talk. So get up and move around if you want to move around. But let's talk about preparing for pillow time, because what we do throughout the day really prepares us for how well we're going to sleep at night. As with most lifestyle medicine pillars, sleep is important across the lifespan. However, prioritizing sleep and really thinking about optimizing your sleep becomes more important now than ever during the menopause transition and beyond. And most women experience some challenges with sleeping during that menopause transition. As hormones are going up and down, we see more night sweats. We see some hormonal changes, which can decrease in estrogen, can decrease can disrupt your circadian rhythm. So it does become more challenging. I would be lying to you. I am evidence-based as much as I can be. If the evidence changes, I will try to tell you what I find. I try to go through the literature so you don't have to stay up to date on all of this menopausal literature. I try to do that for you. But we see that it becomes more challenging on average, not everyone, but for women to sleep or to get high quality, sufficient sleep as they age. But there's so much that we can do. So even though those sleep struggles become more common, often with the menopause transition and beyond, it is so important. Sleep benefits for midlife women. It impacts mood. Research shows that it impacts our quality of life. It helps us with stress management. It helps us with relationship communication, not to mention all of the health benefits with the decreased risk of cardiovascular disease and supporting lipid health and decreasing inflammation. We know that getting inadequate sleep, so not getting sufficient quantity, number of hours of sleep, and 7 is what I recommend people shoot for, at least 7 hours of sleep a night. But getting inadequate sleep, quantity or quality, is inflammatory. It is inflammatory to the brain. It's inflammatory throughout the body. On the other hand, getting restorative sleep, getting adequate sleep, even though it might be more challenging, it might take laying in bed a little bit longer, or it might take really prioritizing what you do during the day to prepare for your pillow time. But getting restorative sleep is anti-inflammatory for the brain. So once again, me being at an increased risk for dementia, I am extra careful to do everything that I can to support my brain health. And the literature shows restorative sleep is so important for decreasing brain inflammation. Now, as I mentioned, 7 hours is what's thought to be optimal. And so this was some really interesting research in Nature Aging. If you pull the original document, you can actually see the graphs. But what they did is they did neuroimaging. So they actually looked at cortical thickness and the cortical volume of the brain. They did neuroimaging in 21,000 middle and older age women, and they looked at their sleep duration. And what they found was that women who were sleeping typically about 7 to 8 hours a night, compared to people who were sleeping really long and people who were sleeping shorter, so the people could do the fastest pair matching when they were getting adequate sleep. They had the best mental health. So they felt the best mental health. Also, women who were getting about 7 hours or so of sleep a night typically had the thickest brain cortex, and the highest brain volume. So those are all things that we want as we go through the menopause transition and beyond. So one of the things that's really important and that really has an impact on our circadian rhythm is keeping a regular sleep-wake schedule. Now, it doesn't mean you have to go to bed at exactly the same minute, but it means really getting your body in the habit of, I go to bed at this time and I wake up at about this time. Now, of course, there's always going to be different things. I typically go to bed around 9:30 or 10, and I am up bright in the morning, bright and early. And so my time is really similar. Last night I went to a theater show that happened to be later, and I went to bed later. So it doesn't mean that you can't change this, but really knowing the best thing for sleep is, as much as possible, really trying to stick to a regular sleep wake schedule. Try to get some bright morning light, to get out there and at least get a few minutes of some bright morning light. We know that light hitting our retina helps with our circadian rhythm, helps to set that for the day. Trying to get in some movement, but not too close to bedtime. So moving more throughout the day also supports better sleep at night. As you get close to the evening, really trying to dim the light. So like an hour to 2 hours before bedtime, really thinking of, what type of light exposure am I getting? I don't want to be under those bright, bright lights. So what can I do as I get close to bedtime to really tell myself it's time to wind down? Can I turn off those screens? The panel that I was on with the ophthalmologist talked about the importance of limiting blue wavelength light, or blue blocking glasses, or can we set our devices so that we're really trying to turn off our screens, first of all, to decrease our psychological stress, but then also to help decrease our exposure to blue wavelength light around bedtime. We know that blue wavelength light, so it comes from the sun, but it also comes from our computers, it comes from our smartphones, it comes from our devices. That blue wavelength light increases alertness and suppresses melatonin production, which is what we want during the morning, right? We want that getting some blue wavelength light, get a little bit of outside, get sun, that's trying to suppress melatonin production in the morning. That's what we want. But as we get closer to night, we want that melatonin to be able to increase. They've actually done research looking at people who used e-readers versus a paper book. And they found that the people, so even if they're reading the same thing, same amount of time, they control for all these different things, the people who were using electronic readers to read before bed, they took longer to fall asleep. They had poorer sleep quality, and they felt less alert the next day. So even if you're like, I don't think it really has that big of an impact on me, I like to read my relaxing book on my e-reader before bed, whatever you can do to move away from those screens. So I have a stack of my paper books. Even though I might read on something electronic during the day, at night, I have my paper books by my bedside as I try to relax pre-bed activities, relax and wind down. What is it that helps you to relax? Maybe it's taking a warm bath. Maybe it's doing some gentle yoga poses, some stretching. Maybe it's journaling, doing some gratitude, writing what you're thankful for during the day. Things that one of the triggers for sleep is a decrease in core body temperature. And so like taking a warm bath or like a warm shower, and then like soon before bed and then getting out, helps to drop our core body temperature. That can help with getting more sleep. Keeping our feet warm, it might sound counterintuitive, but if we're able to keep our extremities warmer, it helps to drop our core body temperature, and that can help us with sleep as well. So maybe you want to throw on some warm socks. As it becomes more common that women need to get up in the middle of the night to use the bathroom. So think about using the restroom one last time. Push lots of your hydration more towards the morning. So don't drink tons and tons and tons of water right before bedtime, right? That just makes sense. You don't want to increase your chances of needing to get up multiple times during the night. So try to, of course, stay well hydrated, but don't overhydrate close to bedtime, and then use the bathroom one last time. Prepare for night sweats. Have a fan nearby. What is it that can help you if you do wake up with a night sweat? Is it that you do want to take a sip of cold water? Like, what is it that will help you? Maybe you want to have a fan that you can turn on. All of those different things help to prepare you for pillow time. So what you do during the day has a tremendous impact on your ability to get restorative sleep and to thrive through the menopause transition and beyond. Now, let's talk about how to enhance your energy recovery environments. So as we move through the menopause transition, we know it becomes more common to experience physical and emotional fatigue. And so we need to be really mindful of our energy levels, not just our time. So we often think about like, how do I best use my time management? But I also want you to think of energy management. When do you have the most energy during the day? When do you feel like you can best do the work you want to do? When do you need to say, you know what, I think I have a rough day ahead, or I have some different things I want to be mindful of really saving my energy, right? Like I'm doing this morning, so I didn't get up and do different meetings before I even came here, right? I'm mindful of my energy management. Also, be gentle with yourself. After chemotherapy, I didn't have as much energy, and still, even now being 5 years out from chemotherapy, I have more fatigue than I used to. And so it becomes very important as we age to, I believe, to really listen to ourselves, to be gentle with ourselves, to think about using our energy mindfully and in ways that we want to. I would say prior to a cancer diagnosis, I was more like, I can go, 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 go. And now my energy is more limited, and I've gone through a life-changing experience, being confronted with my mortality in a very real way. That's made me think I want to use my energy as wisely as possible to do things that I love, to really get the message out about things I'm passionate about lifestyle medicine through the menopause transition and beyond. This is something that I found from I believe her last name is Machiano. I'm forgetting offhand, but this is not my concept. If you look at the spoon theory, or self-care with spoons, you will find this. But this is a concept that I was told about from a psychologist while I was going through chemotherapy. And I said, like I want to do these things, and I still want to be able to take care of my kids. I still want to be able to do X, Y, or Z. I still want to be able to keep teaching because I love teaching. And the therapist said, "Have you heard of the spoon theory?" And I said no. And so it's this theory that Machiano came up with that says like you kind of like start your day with a certain number of spoons. And so like while going through chemotherapy, or maybe as a cancer survivor, maybe I have fewer spoons than I did before chemotherapy, right? But everyone starts their day with a different number of spoons depending on what they're going on with. You can use spoons to take care of yourself, but once you use them, you need to wash them so you can use them again. You can't use spoons you don't have. And so, for example, doing different things might cost you different numbers of spoons. And so maybe it's like, waking up, getting dressed, maybe that's one spoon, or maybe it's doing a craft or cooking or going for a walk. Maybe that's two spoons. Or maybe doing exercise or going to an appointment, maybe that's going to cost 4 spoons. And so thinking about like, how much energy am I going to use with doing this? And knowing that if I want to be able to continue doing these things, I'm going to need to wash my spoons. I'm going to need to engage in self-care, like that green shows. I'm going to need to get adequate sleep, to eat, to be gentle to myself. I'm going to need to draw on support from loved ones. I'm going to need to get adequate physical activity, but not too much, not too little. And to realize that at some times in your life, if you're going through some like a chronic illness, if you've experienced trauma, if you're experiencing mental illness, all of those things can impact the number of spoons we start with, and maybe how many spoons we use when we do these different things. So just to realize, and this says be kind to others, and I would say be kind to yourself too. You may not know if someone else has a chronic illness, they've experienced trauma, or they're going through something. So we all have a different number of spoons. And then to also be mindful and to be kind to yourself. I feel like I do that more now, being a cancer survivor, saying, I know that you want to have a meeting that goes till 7:30 down in Denver. It's going to be an hour drive home afterwards. You know what? I don't think that I can do that meeting in person and drive home that late and feel really good. I'll join you on Zoom. That's actually something that I just kind of negotiated recently, was like, I would love to do this, but doing that in person that late is just not good for my energy. And so I'm going to honor myself, and I'm going to say, you know what, is there, I have another suggestion, and see if that'll work. Also, I want you to think about making your bedroom a sanctuary for sleep. Dr. Beth Brady, she says, keep your bedroom like a cave. So keep it dark. So try and get rid of those blue lights, right? Keep it dark. And I want you to make sure that you have enough light, or you can turn on something. So if you need to go to the bathroom, that you can get there safely, because I do not want you having a fracture or falling or something like that. But keep your room dark, and then be able to turn something on if you need to get up and go to the bathroom. Keep your bedroom very quiet. So for darkness, you can use like room darkening shades if you need to, but get it dark. I have my alarm clock flipped the other way. I don't have my phone next to me. So do different things you can to keep it really, really dark, keep it quiet. I've actually heard from some people too, that they sleep with the TV on. Like, you do not want that. You want that TV. If you have a TV in your bedroom, you want it off, right? You do not want to have that light going on, even if it's on silent or sound. Like, you want it dark, you want it quiet. So keep your bedroom as silent as it can be. Even if if you need like a white noise machine, if you live like in an apartment or somewhere where it's louder, or if you need like earplugs, but keep it quiet. And then keep it slightly cool. 60 to 67 degrees Fahrenheit is typically kind of considered the optimal temperature, but keep it slightly cool. So keep your bedroom like a cave. We also know that as people go through the menopause transition, we see an increase in physical and mental exhaustion, with about 20% of premenopausal women saying that they experience this, about 46% during that menopause transition, during that hormonal roller coaster, and then postmenopause, so no period for 1 year and beyond, we see that 85% of women feel physically and mentally exhausted. So we need to think about what we can do for our energy. Now, I mentioned this earlier already about this is a drawing of that mitochondria, the powerhouse, the battery of the cell. But we know that getting adequate physical activity increases the biogenesis, or the creation of new mitochondria. It increases their activity. We have increased muscle endurance, and it decreases muscle fatigue. So we need to be getting in that movement. In fact, we see that dose dependent response to physical activity. So as somebody gets in more steps per day, as somebody does more moderate to vigorous physical activity, we typically see an increase in their vitality and their energy. So do what you can to decrease your sedentary behavior. Also, this is some literature that comes out of the breast cancer survivor literature, but I think that you might still find it interesting. This was actually research they did on a fatigue reduction diet in breast cancer survivors like myself. And they had an intervention that seemed to show some success. And so they were recommending things that we've already talked about that go along with our blood sugar stability and our emphasizing fiber. Get at least half of their grains from whole grains. I would say try to make all of your grains whole grains. Try not to eat those refined grains. Get 5 servings of vegetable daily. Try to get at least 1 leafy green. I get my leafy greens in every day. There's some great research out there on brain health, on, once again, on muscle strength. So get those leafy greens. Oh my goodness, there's so many reasons to get your leafy greens. This fatigue reduction diet, they had 1 serving of something with tomato, 1 yellow or orange vegetable a day. They recommended 2 servings of fruit, at least one high in vitamin C, and then 2 servings of something that's omega-3 fatty acid rich, such as nuts, seeds, or fish. They recommend at least just 1 day per max from fish if you are someone who eats animal products or is eating fish. Some examples of vitamin C rich fruits: oranges, guava, cantaloupe, kiwi, lemon, papaya, strawberries. There are so many delicious ways to get in those fatigue reducing foods. Also, omega-3 fatty acids. You probably already know they're in many nuts and seeds. I love to get mine from ground flax seeds. You want to grind or buy pre-ground or grind your flax seeds so that you get the full benefit from them. But some different ways to get some omega-3 fatty acids in. Also, there's research showing that micro breaks can be beneficial for helping to reduce or eliminate mental and physical fatigue. They've been found to increase energy, boost performance and creativity, and they can just be 5 to 10 minutes. So thinking about how can you manage your energy throughout the day? How can you take some micro breaks? And maybe this is doing your exercise snack. Maybe it's stepping outside and taking some deep breaths. Maybe it's standing and stretching. Maybe it's calling a friend. But taking these micro breaks where you do something different. Maybe it's you have a certain hobby and you're going to go and you're going to take some pictures for a few minutes, or like, what is it? But how can you take some micro breaks in order to increase your energy? So our environment impacts your emotional energy too. I know for me, if I'm in an environment and I'm trying to multitask, that's not a picture of me, but I've done that before, where I'm trying to cook dinner for the boys and I'm trying to be on a Zoom call and trying to do all these different things. When you're multitasking, that's an energy drainer. When you're having a fight or you're in a confrontational conversation, that's an energy drainer. If my desk looks like this, like when it gets messy, for me, that's an energy drainer. I do best when my desk is neat. I have a small desk. I sit here in my den. If it's neater, I feel better. It does not drain my energy. If I'm tired, that's an energy drainer. Now, And what are energy boosters? So there's some great research out there on energy boosters, and being in nature has been found to increase our energy. And if you can't be out in nature all the time, so I have a window right here that I can look out and see, I can look out and be in nature. I actually have like a suction bird feeder on my window right here that brings nature in closer to me when the birds, or sometimes the squirrels, when they eat some of the bird seed. I also have I have some rocks back here that I like. I have some reeds. I have some different things where I bring a little bit of nature inside as well, some plants. But being in nature has been found to be an energy booster. Doing our hobbies, doing what we love, being with our pets. My dog Cosmo is often in here when I work. He's not in here right now because if he happened to hear a noise, he would start barking maybe during the presentation. But having my pets with me, having my Cosmo, my Portuguese water dog, with me is an energy booster. Spending time with things that bring me spiritual well-being, with being in a state of awe. I'm doing some research right now into awe and how we get more awe and that emotion, and what can we do to really tap into awe and nature, or being able to experience things that make us feel like we're part of something much greater. Spiritual well-being. What are those things that you need in order to support your spiritual well-being that help to boost your energy? Maybe it's getting movement. That's not me on my ball chair, but somebody on a ball chair, right? Like, what is it that we can do throughout our day to really maximize our energy? And then self-compassion, body compassion, self-compassion, being with others, being socially connected is so important for our energy. So now let's talk about taking some breath breaks or managing our stress in order to optimize our health and our well-being through the menopause transition and beyond. So this is the Yerkes-Dodson law, and you can see on the y-axis we have performance. So not all stress is bad. On the x-axis we have the stress level, and so we don't want to be all the way over here where we have hardly any stress, where we're just sitting at home every day, right? That's probably not a problem for most of us, but we don't want to be inactive and bored and have hardly any stress. But too many of us, I know I've been there before, are in that stress overload where we feel exhausted, we feel panic, anxiety, anger, burnout, and breakdown. We're fatigued. So many of us kind of live over in that area as our normal. However, we want to be in that area of peak performance. We want to be motivated. We want to be focused. We want to have an optimal level of good stress and not that distress. And so thinking about how can we make sure that we're at a point where we're healthy? And I'd like you to think right now, like, where are you as far as being on that curve? If you had to put yourself over the last week, where have I been on this curve? Would you be in that peak performance zone, or would you be over in that unhealthy or in that distressed area? And then we'll think about how can you try to help get back to more of that peak performance zone. It's important to understand that as we go through the menopausal transition, as we have those hormonal changes and then a decrease in estrogen, especially with those fluctuations, it increases our sensitivity to stress. It makes it more likely that we become emotionally dysregulated, or that we have a hard time feeling emotionally calm or balanced, especially when something goes awry. And that's just because of the change in hormonal levels. And so I like to tell patients, you are not crazy if you're somebody who thinks like, this used to not bother me so much. Like, if this happened, I wouldn't feel like, oh, this is a huge deal. But now I feel like when something happens like this, I feel like I'm thrown off balance so easy. You are not crazy. This is a diagram that I tried to make this with these little images and things to try to show you what I've drawn on the back of like charts and papers so long. But before the menopause transition, it's like we have a large stress tolerance platform, right? We can be pushed around by those stressors, things go wrong, and it takes a lot for us to have what the literature calls an unwanted stress reaction. Now, I don't know about you, but I have had an unwanted stress reaction before. Like, when life is so stressful that you just feel like, oh my gosh, I'm ready to have a meltdown. Like, life is like, this is too much. I just cannot deal with this anymore. That would be an unwanted stress reaction. And so we can still have those premenopausally, but it takes more to push us off balance. During the menopause transition with those hormonal changes, it's like we still have that stress tolerance platform, but it's like it's shrunk. It's like it's harder to stay in balance, or we're more easily pushed off balance by stressors into that area where we can have an unwanted stress reaction. Now, risk factors for unwanted stress reactions are poor nutrition, unhealthy body composition. So many of the different lifestyle medicine factors that we've already talked about: a lack of physical fitness, inadequate sleep, lack of social support. Those are all risk factors for unwanted stress reactions. So it's important to optimize lifestyle medicine throughout the lifespan, but especially important during the menopausal transition. You've heard me say that a few times now. So we want to do what we can to increase stress resilience, and breath breaks is one of the things that I'll talk to you about doing, but we want to do lots of different things that increase our stress resilience. The research shows us that mind-body interventions, like meditation, like mindful breathing, like doing yoga, all of those mind-body interventions help to increase our stress resilience. So it's like they're helping to push us back toward balance, or maybe make that stress tolerance platform a little bigger. Eating a high-quality diet, nourishing the gut microbiome, getting an adequate fiber, getting adequate physical activity, getting adequate sleep, and having social support. Those all increase our stress resilience. I want you to think about a stress reduction toolbox. What is it that works for you in order to support your stress resilience, for you to help weather life's turmoil, ups and downs, right? We're not going to eliminate stress from our world. So how are we going to become as resilient as possible to it? You have different things. So things that have worked before, maybe it's reading a relaxing book, maybe it's getting out in nature, maybe it's petting your dog. But think about like what is in your stress reduction toolbox. There's probably things that have helped you in the past, or maybe things you've heard about, like, oh, my friend told me that sometimes doing a body scan, or like listening to this YouTube thing on a body scan where I focus on each part of my body and relaxing it and what tension is there and can I release it, or progressive muscle relaxation where I tense up some muscles, then I relax them and notice the difference, then tense up the muscles, then relax them, and kind of go through different body or muscle parts. Or guided imagery, listening to maybe a script on YouTube that talks about being somewhere relaxing for you, or listening to relaxing music. These are ideas. Maybe they're things that you've done in the past but haven't done in a while. Maybe you need to sharpen some tools in your toolbox or take them out. Maybe they're dusty or rusty, and be able to use them again. So I want to talk about 4-7-8 breathing. This comes from or comes out of pranayama. But Dr. Andrew Weil is also famous for really getting this out there in mainstream. But 4-7-8 breathing activates the parasympathetic nervous system. You're increasing oxygen delivery throughout your body, getting that to your cells. It's calming and has been found to decrease anxiety. So I'd like for you to try this now. I'd like for you to inhale for 4 seconds through your nose, and then pause for about 7 seconds. 4, 5, 6, 7, and then exhale for 8 through your mouth. 1, 2, 3, 4, 5, 6, 7, 8. Let's do this a few more times. Inhale through your nose for 4. 4. Hold 1, 2, 3, 4, 5, 6, 7. Exhale for 8. 1, 2, 3, 4, 5, 6, 7, 8. Inhale for 4. 1, 2, 3, 4. Hold 1, 2, 3, 4, 5, 6, 7. Exhale through your mouth for 8. 2, 3, 4, 5, 6, 7, 8. So the power of our breath, we have it with us all the time. We can really, really work with our vagus nerve, with the parasympathetic nervous system. I'd encourage you to think of doing mindful breaths and doing different things that really help you with your stress toolbox in order to support your resilience to stress. So my last of these 8 tips for you is to prioritize people and purpose. So have you ever had a time when you were just surviving but wanted to thrive? That's how I felt when I finished my training as an OB-GYN, and I was like, I need to focus on healthy lifestyle behaviors. And when I finished chemotherapy, I was like, oh my gosh, I did my lifestyle things and I did conventional medicine, but I felt like I was just surviving, but I wanted to thrive. So I finished my treatment, and as I was finishing, I thought, you know what? I got breast cancer, even though I was eating healthy, I was exercising, I was not drinking alcohol, I was nursing my babies, and like I was doing those right things. And so I thought, well, now I'm going to exercise harder, and I'm going to make sure I never eat anything that's not a super healthy food, and I'm going to be adamant about never going to bed late. So I thought I'm just going to like push myself as hard as I can to do everything evidence-based. And so I was really running from the fear of recurrence. I was like, I'm going to push myself, but I'm going to do these lifestyle behaviors because I am afraid of getting a recurrence. My cancer was crazy aggressive. 1 year not there. We didn't see it on a 3D mammogram. And on the next year, a 2 centimeter mass that was invading my chest wall with a really, really high oncotype, really aggressive. And so I went to a survivorship group, and because I had seen the literature, like it's good for breast cancer survivors to do group things. I'd seen the literature. And so I was like, I'm literature based. I'm all in. I'm going to do everything. And I went to one group and they talked about, you have an increased risk of all of these horrible things. Like it was just horrible. And I thought, I can't do that. So I went to one meeting and I thought, I am never coming back. So I talked to my dear friend and mentor, Dr. Beth Frates, who's a physiatrist, a physician at faculty at Harvard, and works at Spalding Rehabilitation Hospital. She's the president of the American College of Lifestyle Medicine. I've served on the board for 3 years. We overlapped our terms. An amazing mentor friend. And so I was talking with her about something else, not related to survivorship, but I just mentioned to her, I went to one of those survivorship groups. It was horrible, and I am never going back again. And she said, what do you think about joining Dr. Amy Commander's group for breast cancer survivors? As I mentioned before, Dr. Amy Commander is the head of lifestyle medicine for oncology at one of the Harvard Health System hospitals. And so the pandemic had just started. And so Dr. Amy Commander, working with Harvard breast cancer survivors, or at her hospital, they'd gone to remote because of the pandemic. So they're all in Boston or that area. And they had just gone remote like the week or so before. And so Beth said, you could join Amy's group. And I thought, oh my gosh, I do not want to go to another one of those horrible groups. And Beth said, nope, this is different. Beth created this about 15 years ago. Her dad was a stroke survivor. And so she created this program initially, a 12-week program, meeting as a group, 10 to 15 people meeting weekly or something, for 12 weeks. And she created this for stroke survivors and their caregivers, all evidence-based. And she said, I think you'll find this very different. Just give it a try. And so because I love Beth and and it was her recommendation, I thought I'll give this a try. And what I really found was that this program was so different and that it helped me think about, how can I run with joy? How can I think about the joy of eating nourishing, delicious foods? How can I think about the joy of physical activity? It gave me hope. It gave me hope for being able to thrive and not just be a breast cancer survivor the rest of my life who was going to run from the fear of recurrence, but really run with joy. And so now we've partnered together, Dr. Amy Commander, Dr. Beth Frates, who created this original program. Dr. Amy Commander modified it and leads it for breast cancer survivors now out east. And so we've done some research on it. And after I finished that program, I said, how can I help? How can I help bring this to others? Because I really saw the injustice of even though I'm so thankful that my insurance helped to pay for chemotherapy and surgeries and reconstruction, I'm so thankful. But to find out that insurance usually doesn't cover survivorship programs like this, like I had access to all of this, but every woman should have access to it. So this is Dr. Amy Commander, and this is the group that I did not join live, but part of this group. Dr. Amy Commander is sitting on the floor there, and then these are other members of the Paving the Path to Wellness for Breast Cancer Survivors group. They're probably meeting in Boston somewhere out there, but I joined some members of these groups, and I learned a different way to move forward as a breast cancer, not just survivor, but thriver. So they run these groups for all different, for stroke survivors, for mental well-being, for type 2 diabetes, for menopause, for breast cancer survivors. This is the breast cancer survivor collage. But Paving is a movement. Dr. Beth Frates, Dr. Amy Commander, and I, along with Val Tivnan, formed a nonprofit organization, Paving the Path to Wellness, to really try to get as many people access to this as possible. We try to help people not run because of the fear of recurrence, but run with joy. And Paving the Path to Wellness is about having a healthy body, a peaceful mind, and a joyful heart, according to Dr. Beth Frates. Those are all such 3 important parts. So the 12 steps of Paving. You've heard me talk today about nutrition and physical activity and stress management and sleep. Those are all important, and social connection. However, those are ones that are covered by a lot of different programs: movement, stress resilience, nutrition, sleep, all very important. But what makes Paving different is that it also includes attitude. How can we look at our attitude around healthy lifestyle behaviors? Was I going to have a growth mindset? Was I going to have an attitude that tried to embrace awe and spiritual well-being and a growth mindset growth mindset and self-compassion. What attitude was I going to carry with me on my journey as I did these healthy lifestyle behaviors? How could I use variety and investigation? Dr. Beth Brady's and I were two of the first physicians ever trained as health and wellness coaches a long time ago. And so it's very important for us that we adhere to the evidence, always are evidence first, bring the evidence forward. But also, we know that it's important to understand the science of behavior change. There's a lot of people who know that they should be eating more fruits and vegetables and moving more, right? So how do we actually help people? How do we meet them where they're at and help them move in the direction of positive change? So we can use the science of variety, of trying different things, trying new foods, trying new ways of physical activity, and keeping our notebook. How does it make me feel when I investigate myself? So it's great if the research shows that meditation is wonderful for the study populations. But if it doesn't work for me, I'm going to investigate, how do I feel when I do those different things? How are my symptoms? How is my energy? How is my mood? Really trying to investigate what works best for me. Timeouts in our fast-paced world. Oh my goodness, timeouts are still a hard one for me, but how do I manage to take time out for myself? What does that look like to create that space, that pause, that area for spiritual well-being, for that joyful heart, as Beth calls, the healthy body is important, peaceful mind is important, but joyful heart. What gives you a joyful heart? Focusing on energy. We talked about energy management and the importance of that, and things that bring you healthy sources of energy, what you eat, and your connections with people. And then probably the most powerful area, I think, of paving is purpose. I did not know the science of purpose. Like, it was just something that was not taught in medical school. Like, I thought a little bit about my purpose, but really focusing on, why am I doing these healthy lifestyle behaviors? Like, I'm doing this because I want to live a joyful life, because I want to be able to share the evidence-based lifestyle medicine message with others. Like, what is my purpose? And so that's why when I finished this program, I told them, I'm all in. The Paving, the Path to Wellness program. How can I help with writing these books? How can I help with this nonprofit organization? And I've donated hundreds upon hundreds of hours to the Paving the Path to Wellness program ever since, as have others. So why? What is your why? What is your why for wanting to be physically healthy? For me, part of my why is my kids, my family. Part of my why is that I want to be able to spread this message. Why? Why does emotional health matter to you? Like, why should you change behaviors, or why should you do things or investigate what supports your emotional health? Think about, what is your why, right? Like, what's your purpose? Why lifestyle as medicine? Why aren't you just going to eat that cake on the way home, right? Why? Because it's going to impact my physical and my mental health. Why? Because it's going to increase my chances of having a shorter life, or stopping for those Krispy Kremes. Like, why is it that I'm going to do these things? So the good news, life is not, I told you about a lot of negatives that happen as far as risks with menopause. But the good news is, if you look at these thriving indices by age, you typically find that they're lowest in the mid to late 40s. But then usually into a woman's 50s, we typically see that thriving index increases. So when you ask people if they're thriving, there's all different things that go into that. But most women would say that they are thriving more and more as they go past menopause. One of the things that plays the biggest role in that is being socially connected. In fact, we know that many women, if you look at all women 50 to 80 years old, they found that 37% of them felt socially isolated. And 33%, 1 in 3 women, has contact with someone outside their home less than or only once a week. So even though we might feel like we have our phones and we're socially connected with all the likes and social media, social disconnection, social isolation, loneliness is way too common in our society. We know that social connection, being connected, increases self-esteem, empathy, longevity, supports brain health. In fact, this is the longest running study on adult development. And this focuses mostly on men, but I loved Robert Waldinger's comment here. And this is a quote: the people who, after looking at all of this data from generations, people who were the happiest, who stayed the healthiest as they grew old, and who lived the longest, were the people who had the warmest connections with other people. It's not the number of our connections, it's about having some warm connections, some meaningful connections. Also, I would love for you to think about, how can you find your purpose or use your purpose through connection? So connection, happiness, and thriving purpose and people, all of those come together. There's a lot of overlap there. So it's important for us to listen to others. It's important to see how our gifts, skills, and talents can help others. For me, a main part of my purpose is being able to take my story and some of the yuckiness from it and to take what I've learned and to be able to share that with others. And being surrounded by what I think is part of what's being created with this community of people coming together to listen to these presentations. You are positive, passionate, and purposeful people. People who come to Paving are passionate, positive, purposeful people. Not positive all the time, not Pollyanna. Life is hard sometimes. Some of those menopausal symptoms are hard. But how can we surround ourselves with positive, passionate, purposeful people through connection? We know that purpose is one of the single most important predictors of well-being, according to Richard Davidson, founder and director of the Center for Healthy Minds. We know that people who are able to feel like they know and articulate their purpose typically have a greater life satisfaction, greater physical health, and improved brain function. The good thing is that it's not just that you either feel like you have a purpose or you don't, but purpose, it improves health and it's modifiable. We can do targeted interventions so you can actually work on your purpose to enhance your well-being and function. And that's what Paving does. But there are ways that you can use looking at the evidence to help us to find our purpose, to help us refine our purpose, to help us feel like we're better living out our purpose. Maybe we have a couple different purposes. Maybe they shift as we go through life. Maybe we want to emphasize this part of our purpose now. But we should work on exploring our interests, exploring how our gifts, skills, and talents can help others, to engage in projects that align with our values, and to focus on your spiritual well-being, whatever that might look like for you. Taking time out for self-reflection, to slow down. I'm a fast talker. I put a lot into these 2 hours, right? Slow down and listen to others, to pause, and to surround yourself with positive, passionate, and purposeful people, often people that are working on these healthy lifestyle behaviors too. I want to leave you with this quote from Gina Shaw. We should emphasize activities and pursuits that we love, that are meaningful to us, and see those not as something extra that we only pursue when we have spare time, but these activities and pursuits that we love that are meaningful to us are essential sources of health and well-being. So you are welcome to join the Paving the Path to Wellness organization and website. We had a cooking class last night. Next week, we have somebody who's discussing planetary health and human health, Dr. Ali Saad. It's free. Anybody's welcome to join, but feel free to check out our Paving the Path to Wellness nonprofit organization website. We have this Paving the Path to Wellness workbook, which is based on the work of Dr. Frates. Not everybody can go through that 12-week program. So this is a workbook that kind of guides people through some of that, and it's used with the programs. All the proceeds benefit the nonprofit organization. They do not come to us. And then, so Beth, Amy, and I did that Paving the Path to Wellness workbook. And then I was telling Beth, as I was going through menopause, I was probably like a year or so into it, and I was like, it is really hard to find evidence-based information that's not saying everybody should use hormone replacement therapy or that you're crazy if you even think of it. I was like, I just want someone, like a source that gives you the evidence, that gives you the information and then says you're smart enough to make the decision or to get the people you need on your team to make that decision. So I said, I'm having a hard time finding that information. And Dr. Beth Frady said, then we should write a book. And I said, no, it takes too much time. My brain is tired. I helped with editing a textbook with 50 some co-authors on it, the Improving Women's Health Across the Lifespan. And we'd done the Paving book. And she said, this is important. And so we met every week. And, a year or so later, we have this Paving a Woman's Path Through Menopause and Beyond book. All the proceeds also benefit the nonprofit organization. And it's not just through menopause. There's so often, I think we talk about menopause, and then we're like, but hopefully you have at least a third, if not more, of your life to live after menopause. I plan on living a long, healthy, joyful, hope-filled life. So the menopause transition is truly a time of vulnerability. I'd be lying if I said it wasn't. Time of vulnerability where we undergo some change, but it's also a time of great opportunity for transformation so that we can go from just surviving to thriving by using these lifestyle tips we talked about today, by focusing on fiber, blood sugar stability, getting in some movement minutes, by doing some resistance training to prepare for our pillow time with what we do during the day, to enhance your energy recovery environment, to take breath breaks, and last but definitely not least, to prioritize people and purpose, because I want for each of you to thrive. And I want you to share this message with others. There are so many people yet who don't know this information. They don't know the power of lifestyle medicine. There are drug companies who are out there telling us about all the benefits of those drugs, and I am thankful that we have them. But there are not enough people who are out there saying, listen to this information, this evidence-based information that not only can help you live a longer life, but that can help you lead a healthier life, with a healthy body, a more peaceful mind, a more joyful heart now and for decades to come. So thank you all for listening. This is my personal email address if you want to reach out, Tollefson@outlook.com. Also, I have my own website, but I'd much rather you check out the Paving. I'm not too into social media and my own like website, but like pavingwellness.org is our nonprofit organization's website. And with the time I have remaining, I'm happy to answer questions. I didn't intend for the speaking to go on this long, but as you can tell, I get excited and I'm passionate about what I do, and I just start talking and sometimes can't stop. So thank you for the opportunity to share that with all of you today.
Thank you so much, Doctor. That was some great information. And as somebody who's not overly concerned with menopause personally, it sounds like it's great advice for everyone, both men and women. It really translates. So we're going to begin the Q&A. We have only about 7 minutes, but let me ask you this question. What is going on in a woman's body during menopause? I feel like, in life, so many things come up in life as we age, and we're just not taught really what's going on and what to expect. So what is going on, and what are common myths about menopause?
Well, so great question. When we're born, as females, we have all of the eggs that we're ever going to have in our ovary and in our ovaries, and so they undergo attrition, just a natural decline as we release them during our reproductive phase, and then just a decline in number as we age. And so, as we see that decline in number of eggs in the ovaries, we start to see a change in hormone levels. The follicle stimulating hormone goes up, trying to stimulate development of new follicles. So we have a change in different hormone levels that leads to a change in estrogen levels. And so that menopause transition, that like several years before actually the cessation of menstruation, is when those hormone levels are going up and down in our bodies, trying to figure out how do we get, some of those final eggs, how do we release them? And so periods often become a little more irregular because our body's kind of going through that transition. So it's totally natural. It is not a disease. You do not need to treat it. There are some prescription ways to treat, as well as the lifestyle things I talked about today that people can use. Talk with your physician, somebody who you trust, risk benefits, or your care provider. So I would say myths is that like everyone should be on hormone replacement therapy. I think that that's a myth. Also, another myth is I definitely don't believe that that's true, or that it's always healthier to be on hormone replacement therapy. That's not true, but also it's a myth that hormone replacement therapy is horrible for everyone. The literature just doesn't support that. The literature shows that for some women at certain points of time, if they're close enough to menopause, depending on their health history, for some women it is okay and it really helps with menopause symptoms. Another main myth that I always try to crush is that vaginal estrogen is the same risk profile as systemic estrogen. So we have hormone replacement therapy. So we have systemic hormones that are like a patch, that are oral, and all of our cells see that those levels of hormones. Many women, especially as they get further out from menopause, have vaginal dryness, genitourinary syndrome of menopause. And so there's a lot of women who suffer. They don't have vaginal intercourse, or it's uncomfortable. And they think, well, I don't want to be on hormone replacement therapy. There's nothing that can be done. But really, there are things that can be done. Vaginal estrogen is not an option for everyone. There are certain people with certain hormone-related conditions where it's not a good option, but there are a variety of things. There are vaginal moisturizers. There are vaginal lubricants. There is vaginal estrogen, which has a very decreased, or a very the risk profile is much, much lower compared with systemic hormones. And so too many women suffer in silence, just thinking that this is the way it has to be. And I want them to go in and talk to their healthcare providers about options. And it's one of the reasons why I like in the Paving Path to Wellness Through Menopause and Beyond book, I talked about vaginal moisturizers and vaginal lubricants and intimate relationships and genital vibratory stimulation and the changes that happen in a woman's body, because we're just not taught enough about it. And women deserve to have that right to know.
For someone who is concerned about their hormones or their hormonal levels, are there when should they be concerned? When should they consider hormone replacement, and what natural alternatives through lifestyle medicine can they check out?
Sure, sure. So we really go based on symptoms and then looking at somebody's their personal health history. So we do know that being on hormones, so if a woman has a uterus, we know that in addition to estrogen, which typically helps with the hot flashes and night sweats, they need to be on a progesterone as well. Otherwise, the risk of uterine cancer goes up too much. And so we know that if we're using those medications, we shouldn't use them in somebody with a history of a hormonally positive cancer. We shouldn't be using them in somebody who's like had a stroke, because estrogen is going to increase the risk of a blood clot. Our risk of a blood clot increases when we're pregnant. That's just what happens when our estrogen level goes up. Now, whether or not they're bioidentical or not, there are some hormones such as like Premarin Premarin stands for pregnant mare's urine. And so the Women's Health Initiative, those big studies that came out back when I was in residency, that really showed some of the harms, that not everybody should be on hormone replacement therapy as we kind of used to think when I started training. So those studies showed us that there are some definite risks, and those weren't bioidentical. We do have bioidentical or hormones with the chemical structure that's the same as a woman's natural hormones. But just because they're bioidentical doesn't mean that they don't come with risks. I think sometimes that's a myth too, as far as so my husband's he was a compounding pharmacist. Now he's not in that compounding pharmacy, he's a pharmacist. But I think sometimes there are places that suggest that every woman should have salivary testing for hormone levels. In certain circumstances, it can be good for certain things, but like during a woman's hormonal fluctuation, I mean, you saw that roller coaster. It can change from day to day. So it's more important to go based on symptoms. But it really is a discussion with that healthcare provider as a woman starts to experience those symptoms. Do they want, like, how disruptive are they to their life? Then looking at risk benefit ratio. What are the risks associated with hormone replacement therapy? What are the benefits? Will I be able to sleep more? Are there other things that I can do? There are lifestyle medicine suggestions. For example, the research by Neil Barnard that showed that about, I think, 88% of moderate to severe hot flashes or that hot flashes were decreased by 88% in women who did a half cup of soybeans daily, along with a low-fat plant-based diet. And so there are other things like that. Will soy work for everyone? Nope. There are some women who, if they do it, it's not going to work. We don't fully understand that. Is that the gut microbiome? But there's a lot of things that we can do that we should be doing anyway. And so we can do those things. If we're not allergic to soy, we can do some organic soy, and we can do some physical activity, and then say, like, how do I feel after all of that? And if somebody is still really struggling with hot flashes and night sweats that is disruptive to their life, that is negatively impacting their quality of life, go talk to someone. And it's not just hormone replacement therapy. There are other medications too that we can use. Once again, all medications, risk benefit ratio, right? But if somebody, especially if they're in their 40s, is often when women start to experience some of those different symptoms, especially late 40s. It's important to stay really connected with a gynecologist who understands that, or a healthcare provider who understands that. There's NAMS, the North American Menopause Society, a lot of great NAMS healthcare providers who are really good with menopause and staying up to date on that literature as well. And even though there's not literature showing that yoga or physical activity or soy works as well as hormone replacement therapy, I think that's where every woman deserves to know what the evidence is, so that they have a whole toolbox, right? So they have all these different things, and so that they can say, what are the symptoms that I'm experiencing? What do we have out there as far as conventional medicine and lifestyle medicine? So they can make an educated decision as far as what do I want to use, and for how long, and at what dose. And that's really where you need to find that provider where there's a good relationship, where you trust one another and can really really engage in shared decision making.
Thank you. We're basically out of time, but I do have somebody who's asking me a quick question, and you are a great resource. So I want to ask for a 30-second answer, if possible, for people with depression. Actually, this person brought up the word anhedonia, which I guess is not finding pleasure in things. how does one identify activities that might give them joy and in 30 seconds or less?
Oh, wow. Wow. Okay. So I would say you would want to do all of those different lifestyle things, right? So you're focusing on connection, you're focusing on nutrition and movement and stress and sleep, all of those different things, hobbies. That's all important, but then also needing to look at what's that underlying cause. And so that's where I would encourage them to see a healthcare professional, a mental health provider. There are so many people who struggle, and I think that lifestyle plays a huge role, but there are some people who can benefit from additional, whether that's psychological therapy, mental health experts, or medication in some circumstances too. So I'd encourage them to reach out and to see an expert with no shame, blame, or guilt. Reaching out for mental health help and working on your mental health is truly a sign of strength.
Great. Thank you so much, Doctor. A lot of really great information. And again, that applies, I think, to everyone. So with that, if we can unmute the audience so they could share their appreciation.
Thank you for the opportunity. Thanks, everyone.
Thank you.
Thank you very much.
Thank you. Thank you very much.
Yeah, but he says we just signed our new